Hello everyone, welcome to Field Notes, an exploration of functional medicine. I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. Today we are fortunate enough to be joined by Lorne Carroll, who is the head of the public health in Homer and a public health nurse and a fellowship recipient in public health, and also a really wonderful person I've known in the community for a number of years. So good afternoon, Lorne, and thanks for taking the time to be on the Seaworthy podcast today.
Hey, Rob, thanks for the invite. I'm glad we finally got together.
Yeah, we've been talking about it a while.
Yeah, I think that email stemmed back to like August, and it's good to finally close that loop.
Yeah, wonderful. I'm very excited, and it's perhaps sort of like a Jungian synchronicity type timing, because I'll be getting the COVID-19 vaccine this afternoon as a member of the hospital. So maybe the timing's perfect, since you and I both do a lot of work in that domain, and that'll be, I think, the anchor of our discussion today is what's going on with the pandemic and things like that.
Yeah, what a day. I think today's probably the first day that anyone in our area, Southern Kenai Peninsula, in Central Alaska has received a vaccine, probably this morning at 7:30.
Yeah, I feel really fortunate. I was a little intimidated by whether or not I deserved it, but then I realized I could easily end up in the front lines or as part of a field hospital, and I've got the training for it. So I felt like, okay, bring it. That sounds good.
Yeah. I had the same thoughts. It's like, you're thinking kind of like, first do no harm, and other folks could get this vaccine. But you're right. Kind of in the time of COVID, like no other time that I've experienced, many folks are taking on not only different and unexpected roles, but many unexpected roles at the same time.
Mm-hmm.
It's really it's something.
Mm-hmm. I certainly was able to, in my heart, endorse the value of me getting the vaccine when I came back to the premise that a lot of what I do is about the ability to be effective by being able to have my cup spill over. That's sort of my perception of healing and vitality promotion, is to come from a position of strength that sort of brings that out in others. And so certainly having enhanced immunity against COVID gives me some armor to be in those hairier settings. And I also think it sets a good example to enthusiastically endorse immunization when it's available.
Yeah, well, you're kind of in line with CDC's advisory committee for immunization practices, amongst other alignments.
Yeah, well, let's make sure and introduce you properly. So, am I describing your credentials accurately as being a public health nurse?
Yeah, you got it. That's it. I'm, in our system in Alaska, I'm what you call a public health nurse 3, and we've got several varieties of that one. We've got ones that itinerate, and we have ones that are team leaders, and we have ones that focus on emergency preparedness, and we have ones that focus on substance misuse and addiction prevention. And that's a little different from the whole scale that kind of goes from office assistants to, and then you kind of enter public health nurse 1, 2, and then the public health nurse 3, which I am, and then public health nurse 4 is kind of a sub-regional manager. Public health nurse 5 is a regional manager. We have 3 of those, and then get into like deputy chief and then the chief. And then I'm the team lead variety of a public health nurse 3. So it kind of means 2 things in a nutshell: is able to ideally apply expert level services of population focused healthcare, and then secondly also be able to guide a team in applying population focused healthcare to kind of our assigned catchment area, but also to the state. We're a statewide facility.
Understood. Thank you. And then you're doing a fellowship now via Johns Hopkins that's also part of a
a project. Can I have you share with our audience, who I thank for joining us today, what that facet of your work and your passion is?
Yeah, yeah, that certainly came as a surprise, to be chosen. There's 50 people in the U.S. chosen from those who applied, and there's actually two in Alaska, and therefore pursuing not only a master's of public health degree, but also the idea of, it's called the American Health Initiative. The idea is to offer what they call world-class training at Johns Hopkins for public health, but also to create and leverage a nationwide network of public health leaders. And the goal there is to, change and advance the way that we think about public health, and public health being all those things that impact the health of all of us.
It sounds really exciting.
Yeah, for sure. We actually just had a summit where I'm part of the third cohort. It's a newer program, one cohort per year, and we just had a summit last week, a 2-day summit. Pretty wild. They're pretty exceptional at developing really happy, excited people. It's pretty unbelievable, and the timing couldn't be better either. I mean, given the pandemic.
Right. It brings it into tight focus. Things that otherwise might seem a little more conceptual.
Yeah, that's right. It was just a few months ago, for sure. If you ask somebody, what's a public health nurse do, you would certainly get a different set of responses then as compared to now.
Well, it's a good time, I think, then to let our audience know a little bit about conversations you and I have as we are walking the beach or at our local store, Save You More, which every Homer local or person who lives on the Kenai will recognize, but people around the country, it might be similar to their local bakery or their local coffee shop if they lived in New York or what have you. And we ran into one another at Save You More and said, well, here's this experience again where you and I are excited by the ways that a knowledge base, for example, your fellowship or things you've been thinking about recent years, or for me, functional medicine, creates a wider lens to provide resources to people so that they can be healthy and vital. And it even uses vitality itself as a tool, as opposed to in medicine, the problem would be an undue focus on disease management. In public health, it might be ideas that have changed and practices need to catch up. So I'll share a little bit later in the conversation just a couple of what I think of as little gems for people about functional medicine and COVID, but you're the star today. And one thing I'd really love to hear about today is you said it's really exciting to you, these new conceptions around public health. So can you tie that in?
Oh, yeah, I'd be happy to. In the state of Alaska, the Department and Division of Public Health, and like myself, the public health nurses, a lot of ways to talk about it, but one way is that we kind of use a social and ecological model for approaching improved community health outcomes. And said differently, Robert Wood Johnson does a good job of like shifting the language. We're really looking to focus on trying to answer the question, what are those things that makes the places where we're living, learning, talking, eating, and playing better? And the idea behind that is that from that lens or perspective, it's those factors or determinants of health that are responsible for all diseases and resilience factors.
In functional medicine, that would be called an upstream focus. Where are things coming from? But also a frequent reference in functional medicine is root causes. What's at the root of things? And I think that might be why we get all lit up every time we run into each other, is that's kind of how both of our minds work, is that we're really intrigued by root causes and upstream phenomena.
Yeah, and it's not easy. Like I guess I've been in public health practice since 2004, and I started professional healthcare in '97. But I didn't really start connecting the dots or able to unpack it in my head, like how do these environmental and social context impact the health outcomes of, say, a kid that's 0 to 5 years old, or an adult or a family. Um, so it's not easy. It is certainly, people used to tell me and mention public health arts and sciences, and I thought, yeah, arts and sciences. And then I started to ask myself, what in the world does that actually mean? I get the science piece, evidence based or practice, promising practices. That makes sense to me. But the art piece is probably still a wonder. But yeah, it's hard, or it's been hard for me to make the leap from understanding how building a trail in a community can decrease the incidence of violence. So that in itself demonstrates like a social and ecological determinant of health. And if you do a little bit of math or comparison, if you compare that to social needs, or preventing one instance of violence in an individual or family through any system or intervention, then you've got a lot to talk about. So the subject and the content that's going through my mind continually is, what is the best position for public health professionals in our interventions? Is it to focus on social needs or social and ecological determinants of health? And then how do we do that? But of course, the answer is both. It's not a versus, but it's both. And then really in the social and ecological framework, it's really exciting because theoretically, or I guess actually evidence-based, the return on investment is greater. So not to downplay social needs at all. We got to have healthcare, but that's what gets me fired up.
One of the things I think about is that as we conceptualize things, it's important for us to start broad and say this and this and this and, because they all matter. But often pragmatics or practicalities of funding or resources or perceptions of value then lead to a need to influence where resources are going to go, where a program's going to go. Is a trail going to be built versus shelter or another team member or something like that? And I think sometimes then having that broader, deeper background can lead to higher impact decisions, because it helps the other decision makers in the process benefit from your training.
Yeah, that's so true. Like I really just started connecting all these dots, 4 or 5 years ago. What I think I heard you, part of what I'm picking up, or at least my challenge has been, when you consider all determinants of health and what an organization or a professional could do, the potential of options is big. And so it offers the question, how in the world would you know what it is to do? Um, Not even to mention if it would be impactful. So that kind of is where professional standards of a public health nurse come in. So thanks to our multiple professional organizations, they've actually built core competencies in scope and standards that outline how a public health nurse would, potentially approach. And it's really all based upon, it kind of holds up like a nursing practice model in a way. So we evaluate what's going on or the health status of a community. Think about what pieces of the local public health system could fill those gaps and promote health. And then ask, did that work or not? And then the cycle continues.
Well, it's good news for me about the importance of that, and that it's part of the grist, of the mill of what happens in our communities. And so it is a present process in the well-being of a community. And it sounds like then there's a a group of individuals who have, as you say, core competencies. And then when there's added dimensions of learning or pursuing a master's or getting to be around thought leaders who see this on a national and an international level, then that really kicks up the firepower of the, the ability to impact, but also to inspire, perhaps.
Yeah, for sure. And that, the thing about it in it and is that the impact does not exist without relationships and working with communities in a culturally competent way to do what it is that they've defined that they want to do. So that's just a whole nother list of core competencies of a public health nurse, is a culturally competent approach overall, but especially not to mention Alaska, with Alaska Natives' history of colonization in the past 150 years, to be sure.
Yeah, I'm glad you mentioned that. Having been a physician and the medical director at the local tribal medical center for a few years when I first arrived in Homer, and then also practicing in Kotzebue from 2000 until 2002 with a really large Inupiaq community, there was a whole real world understanding of how to relate wisely and appropriately that I was able to kind of internalize. I think I came into it with some best principles, but there was a whole nother dimension to that came from actually doing the work in a wise, respectful way. And thankfully my missteps were few, and the people that helped me correct my missteps were really gracious with me, which was one of the things that I was very thankful for. Largely Native people taking me aside and saying, next time, why don't you do it this way? Or why don't you remember the standard pause before speaking with a Native elder is 90 seconds.
Yeah, that's so, you speak of, when you mentioned that, like I had chills going up the back of my neck, and it's probably been a while since I've had chills, Rob, thanks. But
Yeah.
the chills come from this. Those are shared experiences that definitely mirrors a lot of my experiences in Nome. I first landed in Alaska in 2009, and kind of similar to you, I was hired by the tribal healthcare system, which is actually the largest tribal healthcare system in the U.S., serving over 180,000 people. And Norton Sound Health Corporation hired me to be a TB tuberculosis nurse consultant. And Nome, like Nome's got 15 villages in that particular area, accessible mostly by plane or helicopter. And yeah, I remember kind of one of my biggest memories. I was there for 4 years. Is I really learned a little bit more about how to listen and not speak. Still working on it. I'm a work in progress.
I think a reality is process, not perfection.
Yeah. Well said.
Yeah. One of my, since it is in the domain of resilience, perhaps it is apropos to mention it. One of the most poignant and lovely stories for me during my time was that I met a man from Noatak Village, and one of the first times he'd ever come in for healthcare was when he was 82 years old. So he came down the Noatak to Kotzebue, which is 20 minutes in a plane, an hour and a half or two in a boat, frozen in during 5 months a year or 6 months. And he had gout, really severe gout. And so his family wanted him to get evaluated, but I noticed that he kind of held his right hand in an unusual position and did everything with his left hand while we were chatting. And as we just alluded to, he was a supremely peaceful person, almost like a supernatural pool of stillness around him, right? Like I just felt peaceful being with him. And his eyes had this, what seemed to me to be this great clarity. And so just while we were waiting for some lab work to get done and some papers to get filled out, I said, do you mind my asking what happened to your right hand? And he said that his younger years, he was a reindeer herder. And when he was out with his dog team, his right hand got trapped in the leads and he got dragged by his dogs. And so I was sort of shocked by this, to me, a trauma story. And so I said, well, what did you do? And then he paused and he looked at me and he had this, little kind of Mona Lisa smile, and he goes, I learned to use my left hand.
Mm-hmm. Beautiful.
So sometimes the answers are right in front of us, but our tendency to intellectualize or freak out sort of gets in the way of just being resilient and adaptable. And I do think that'll be a fun theme to explore a little bit today. Maybe I should share with our audience, my rationale for talking was first and foremost that you and I both look at the world in a similar way around resilience and vitality. We've talked about that a little bit. But I think also we believe and see in action when these things are done, sort of vividly sharing this information with others or working in a fashion that brings out the best in people, they do better. That's the key. These are concrete outcomes we're talking about, whether it's a person or a community, when there's a focus on vitality that's science-driven, heart-driven, insightful, outcomes can be improved. And so I thought I would just share a couple of specific things about how functional medicine helps with COVID, because I think the great challenge right now is that the stress of COVID, I think of it like a flexible metal rod. And so if you strain it, the scientific term is allostatic load. You're putting it under load. And if it's tempered, it'll pop back, it's resilient. But if it's not adequately tempered to withstand the load, then it'll crack or snap. And so the idea of functional medicine is that there are principles that people can deploy that help their resilience in the face of this stress of COVID, either getting the disease, avoiding the disease, recovering from it properly, and the related issues, just that it's a drag, as everybody knows, at best, to just get through this thing as a state, a country, a society, a planet. And so Institute for Functional Medicine has focused on sleep, eating the rainbow, getting some exercise, and there's specific science that goes with why these things help the immune system, whether it's more white cells or what have you, less cortisol, which dampens immunity, sleep itself helping immunity. But also Institute for Functional Medicine has focused on a few supplements that can be helpful, and maybe we'll chat about those in a little bit. So can you share with us what you're learning during this that you'd like people to know from the perspective of your expertise? Like, what would it be great for people to know from an expert like you about, as a person or as a community, the best possible, most vital, wise way to get through this stuff?
Wow, that's probably the toughest and the best question that I've been asked today. And I think it, kind of the biggest thing I've learned in my journey, which is professional and personal, is that everything is connected. And so I kind of, in a way, learned this from one of my mentors, Linda Warman, who was the previous chief of the section of public health nursing in Alaska. Connecting the dots is kind of how I think of it. And kind of the root concept within that is that all variables within one's life and up and down the timeline are connected and impactful for not only your moment in time, but also your moment in health, including resilience factors and outcomes moving forward. And so that concept and thought pattern is transferable to the community level too. So I guess I would say, that's it in a nutshell. And especially right now, it's the best time ever to be leaning into resilience factors. This graph keeps popping into my head about, the Great Recession of and around 2009. When thinking about social and ecological determinants of health outcomes. When looking at the economic health of different demographics across the US, from 2009 to up to 2015, every demographic economically revitalized to the pre-recession, Great Recession era, with the exception of Black Americans. And that brings up a really good kind of point. It demonstrates that there are these other numerous determinants of health. And that's kind of one of the few collateral benefits of something like a pandemic or a crisis, is that it puts those things really in the forefront and makes them a piece of conversation. And then the next step would be to continue working on them as a team.
Well, I've kind of got the chills now because that's so important and interesting to me. This year at the Institute for Functional Medicine Annual International Conference, these issues then around African Americans and being socioeconomically disadvantaged, then tied to higher likelihood of blood sugar being suboptimal or silent inflammation, which then sets the stage for that individual or group of individuals to have poor resistance against getting COVID, poor resilience during it, and a poorer prognosis for a good recovery because of, essentially silent inflammation and the tendency of the SARS-CoV-2 to, hijack inflammation and generate these cytokine storms. And so in terms of connecting the dots, there was this feeling of, okay, you've got a group of individuals, African Americans, saying, hey, there's been this disparity. And then through my training, I'm able to see, oh, here's the specifics of it in functional medicine. And this whole continuum then of how does recognition of this become more refined? What's the place of respect and wisdom in all of this? Where's the science? Where's the common sense? Where do the strategies get deployed? And another thing that came up this year is there need to be more African American functional medicine providers. And that was poignant because those ratios are skewed. So there were some really gritty aspects of all of that. And it was just super interesting and important. And I respected IFM a great deal for saying, hey, we acknowledge and respect that these issues are happening and we are actively engaged in being serious about this.
Yeah, it's I feel like, and I think I mentioned this at Saving More the other day, is that it seems to be more and more apparent to me that things like including change and discovery can happen during crisis that can't help to happen otherwise. Yeah, this is the perfect time to be asking questions and discovering, like, for example, let's uncover what systematic racism is in each of our organizations, in our own community, but throughout the state and nation. That's not something I am an expert at, but I'm incredibly interested in learning.
Yeah, I find it intimidating just because it's so important to me to be respectful and accurate that I tread there carefully just because of the intimidation factor of wanting to get it exactly right or not say anything at all.
Yeah.
But not a time to be silent either because the data is there. And I think, again, we're talking about a statistically data-driven observational issue here as you and I wear our professional hats. We're talking numbers and sociology and public health determinants, clinical outcomes. So we're obligated to respond from an evidentiary basis.
I can relate totally. I feel a little hesitant to comment because, I'm a privileged white guy, had a great childhood, and now I'm kind of living a great life in Alaska. But when I'm in those moments, I find myself I'm gonna stand inside of my body and just be me. And it's interesting, I found this kind of full circle thing where it's almost as if I'm back in Nome, where my main objective is to listen and take it in, and
Hmm.
that's coming across to a little bit as I'm like back in school, and extending my network kind of more nationally now, in addition to locally, as in the state. It's y- yeah, it's definitely a good opportunity for me to listen, and kind of in that too. Just discovering what these, I was mentioning this to a coworker yesterday, like discovering what honestly what these words, what does humility mean, and what does it mean to be humble, and and then go ahead and explore that. And I think that those probably have a very important role, within my profession, and within my roles, to say the least.
Hmm. Well, I certainly would make the personal observation that physicians in the United States end up with a lot of power. And one of the most challenging things for me has been to realize that it's intimidating also that power is a personal corrosive. And it actually directly undercuts humility. And I find humility to be the single most powerful clinical tool that I can bring. So if the two are diametrically opposed, which means I'm always trying to make sure that having power doesn't get away from me because I don't want it to undercut the ability to be a good doctor. So I find those things really fascinating.
Yeah, same.
So I wanted to backtrack a little because one of the things that you said was one of the most mind-blowing concepts I learned about in the last few years, and it was one of those big aha moments. The father of functional medicine, Dr. Jeffrey Bland, he has cited another. So he's one of my heroes and mentors, and he cited one of his heroes and mentors who said that learning is incremental. It's not this steady slope. There's these sort of gaps, and then there's these aha moments, and watersheds come out of these aha moments. So 4 or 5 years ago at one of the functional medicine conferences, there was this discussion of complexity versus being complicated. And what the lecturer was trying to describe was systems biology, like an ecosystem. And you referenced this, everything's connected.
Mm.
So when you push on one node, they're all linked. So there's this flex in the web, the interconnected web. And so the person trying to get us to all be able to get our heads around this, they said something that's complicated is like a machine. And so they cited the Saturn V rocket. They said it was the most complicated thing ever built at that time by humanity in terms of the number of moving parts, et cetera. But it was inherently rigid intellectually because it was a whole bunch of parts. At the end of the day, it was still a machine. This lever pushes that thing, that dial turns. And they said the thing that's happening in human physiology is complexity, which is different. Complexity is systems biology. All of the nodes are connected. So when something happens to one dot, what do all of the other dots do? And they encouraged us to start thinking about people's outcomes as a personal ecosystem of well-being with interconnected nodes of mental, emotional, spiritual, inflammation, gut function, lifestyle factors, how the person came into the world, were they breast or bottle fed, C-section, trauma history, like the whole thing. How do you get your mind around the
Hmm.
whole thing? And then have the training to figure out what to do, when, where, how, and what order. And it's actually a systems, you have to approach it from a systems biology issue because it's not like fixing a Saturn V rocket. It's like trying to have a healthy ecosystem in nature. And that aha moment, after that, then I concretely challenge people to eat properly if they wanted to work with me. Because it's like, well, if you don't have whole food coming in a variety of colors, like we can use supplements till the cows come home, but that ecosystem's just not going to shift enough. That ecosystem of you, the supplements are just going to sort of go nowhere. So I took something really concretely away from that. I was really struck by you invoking this idea of these systems. It sounds like systems biology to me, what you were talking about.
Yeah, to be sure. And I really relate to that verbiage, and then as I'm thinking about, my professional role and like how would I say, bring on a new employee and train them, or how would I work with, say, like an Alaska Native community leader, community member, or any other community group. And it kind of what I have found is that there are several other important dimensions, like say number one is to find and establish a shared language, meet folks where they're at so that you can even um, kind of approach a conversation. I'm wondering if you find that to be true or relatable, not only as you're working with individual clients and families, but your other roles too.
Oh yeah, I'm biased in that respect because I love language, and it's a huge
Mm,
part of how I not only relate to the world, but about how I relate to the internal world of ideas and my personal and spiritual growth. And then not a a published poet other than like a single self-published book in my early 20s, just out of this sense of wanting to get it done and get a Library of Congress
hmm
number. But as a poet by temperament, then the distillation of language and the impact of words and the precision of language becomes super interesting. And one of the great dangers for doctors is talking above talking medicalese. And it's a real disservice from my perspective, because A, it creates a hierarchy, and B, it puts the concepts out of reach. And so I just use metaphors all day, every day in my practice. If I talk about the gut barrier, I talk about a healthy gut barrier that doesn't have leaky gut being like a brand new Gore-Tex jacket, and a gut barrier that's got leaky gut being like a 5-year-old Gore-Tex jacket, because most people that live in Alaska can relate to that.
Relate.
And I also find during the discussion with that person, the related issue is attunement. And so from even the tiniest little creases in the person's face versus the openness or brightness in their eyes, I can also see if I'm getting the language right, if we're resonating, or if I'm like, don't quite have the radio station right for how their
hmm
tuner knob works. And that might be to
hmm
me like the greatest joy of one-on-one clinical medicine, is just
hmm
that each interaction is trying to be the right radio station for that person in that moment.
hmm hmm
And so to me, language then, the key is that it be language that's resonant to that person and understandable, but also fresh. The related thing is that concepts become so stale or caricaturized or cartoonish. So the classic thing is when the doctor recommends that the person exercise, it doesn't even register.
hmm
It needs to be redescribed as movement, because they've heard it 100 times from the doctor to exercise, and they've seen it 1,000 times on TV, and they've heard it 50,000 times since they were born. So they've already got a relationship to the cartoon or the caricature of exercise that's either healthy or unhealthy. And it hasn't occurred to them like exercise / movement needs to feel the way I felt when I rode my bike as a kid. That's what we're talking about. So I just find all the time having it become fresh and alive in the moment. That to me may, in a way, that's kind of a summary of the whole project.
hmm
I
I'm
don't
I'm
know.
relating to the I'm relating to those comments through like our public health nurses goal to have like a very culturally competent approach, being that yeah, the same thing you said, but only as like a population focused lens. um when I get public health nurses started in their public health nursing career, uh, um a portion of our services are itinerating. So this would be um, travel on the road system or off the road system by plane to a smaller community, based upon invites from the community to come. So one thing I certainly offer to the new folks and remind myself of is like the first objective is to be invited, And then the second objective is just to listen and learn, or said differently, is meet those folks where they're at. And
Mhm.
then my approach often tends to be not even offering an intervention or resources unless asked,
Mhm.
so said kind of in a different package. A lot of our work as public health nurses in Alaska is built off of relationships.
Mm.
And in some communities, it can take years to develop a
Mm.
relationship, even just to enter the community,
Mhm.
which is uh, I got to say, which is just fascinating and kind of one of the most exciting things about the job.
Well, I'm so glad that you mentioned that one, because to me, again, it's so humbling. And what I mean by that is that the related thing I might say is it feels very real to
Hmm.
me. And I think one of the most sobering things of being interested in mastery, mastery as a clinician, mastery as a public health provider, mastery as a contributor to the community, certain things are nurtured over years or decades.
Hmm.
They're not rushed. They can't be rushed. That's part of their beauty. Like, they can be damaged easily, but they can only be nurtured slowly. And that same focus again of listening, and and I think that's the part I skipped at your prompt, was that I'm always working to get better and better at starting the process by, like, every single new patient starts with, "Thanks for filling out the forms for us. What's concerning you, and why did you want to try functional
Hmm.
medicine for it?" And it's open-ended. If they go 5 minutes, great. If they go 1 minute, great. If they go 10 minutes, it's just that first
Hmm.
bolus of information. And to me, it's the first sign of respect. I want to hear from you in an open-ended fashion what drove you to this moment. And it's always, always, always got clues,
Hmm.
because uh, my wife wants me to be well, versus I have this real passion for running, versus my gut hurts and I don't know why. Those are three completely different
Hmm.
motivations. And then that's the first step of attunement, is like, well, what does this mean then for the first response? And I find the first 15, 20, 30, 45 minutes is like, oh, tell me more about this. Tell me more about that. What
Hmm.
about such and such? So it's
Hmm.
all of this grist for the mill. And invariably, I hear from folks that is the sense of trust for them. For a number of them, fairly or unfairly, it's the first time they feel deeply heard in a lasting fashion in the conventional medical system in the United States.
Wow. Not only is that incredible, but like again and unexpectedly, like I'm relating this to a population focused um, perspective. I feel the same things when interfacing with a community. And the thing about it, one of the things, and is that when you meet someone, what I'm hearing in part is you're recognizing that they're an incredibly complex person with not only a past and a present, but a future. And there's countless variables impacting their health. And this is the same for um, population focused healthcare. Exactly the same.
Mm-hmm.
Fascinating.
Yeah. Yeah, it's really something. I'm glad that it's humbling, because again, then I think that leverages my humility. I feel intimidated, like there's no way to land on that complexity except coming from a place of like humility and stewardship, like kind of, you know, um, just wanting to be worthy of doing that well, and recognizing a number of the key pieces are always going to be sacred pieces of information to that person and or highly private. And so it's got the same level of trust and privilege as like clergy or healers in communities for thousands of years. And so I've just gotten to where I'm super, super careful about how I go into that space. Like, I
Mm,
try to brush any cobwebs out of my mind each visit,
mm,
and take a deep breath. And if I've got any little grudges or pettiness in my heart, as I close the door, I try to flush those out because I just don't want anything, contaminating that sort of like sacred space.
Wow. That's I'm going to carry that away from this.
I was thinking of one more story that I just can't resist sharing. I know it makes me guilty of hopping around, but Barry Lopez, who loves Native people of Arctic, places, wrote that he felt that one advantage to being a Native person of the North is an identity more around we than me, which is another powerful thing, particularly for Westerners who tend to be somewhat, I would say for myself, a little bit involuted and sort of self-oriented in good and not so good ways. But so I had a friend when I lived in Kotzebue for 2 years, and his job for the subsistence division of the Alaska Department of Fish and Wildlife was to interview Native elders about wildlife patterns. So he'd go out to villages and hear that there used to be caribou that would cross there, but then they would cross here. And his observation was that tendency then not to become overly fixated on the South made Inupiaq natives exquisite observers, because they had very consistent, undivided attention out with less hang-ups kind of about me. And so he recalls talking with a woman in a village, and again, sitting quietly, right? Just sitting quietly. And he said that she pointed to a stick in the creek near her home, and she said, "Do you see how far the branch on that stick is coming above the surface of the water? It's about 3 inches out." And he said, "Yes." And she said, "Last year at this time, it was 4 inches above the water. So this year the blueberries are going to be 2 weeks late." And I just love that, like how much was packed into that anecdote. And I have found then the related thing that's inspiring to me is a sense of selflessness in the moment. So I find then if I can kind of be in a just a state of ease and peace where I'm not worried about my to-do list or shopping or whatever, but just think like I need to be there for this person. Another thing I see as sort of mastery or trying to attain mastery is there are surprises. I'll think they're there for one thing and they're there for something else. And the part I flashed on that I'll carry away from this, amongst a number of wonderful things from today's conversation, is that I have a friend who's repeatedly pointed out simply being present and hearing the person is often the most therapeutic thing that happens. So his point is sometimes they don't need the community plan or the whatever as much as they need the therapeutic experience of being heard. And wow, we could talk for hours just about that.
Right. That's so true. I feel like
of it as, oh, sorry, go ahead.
Pardon me. Just even hearing that is, and I think I shared this joke with you the other day. Hearing that I have this reoccurring theme lately inside of my head, and it's kind of a joke to myself. It kind of makes me say, I feel like I was born yesterday, Rob.
Right. Yeah.
It's true. I've been in healthcare for like what seems like a long time now, but every day it's just like, man, I am learning each day, kind of like I'm a new grad, and it's just like, wow.
Yeah. Well, maybe there's something about that. Everybody's got a different temperament. Maybe we have similar temperaments that way, but it's, I had an administrator, I mentioned I wanted to rebuild the way I practiced 7 years ago. And she said, "There you go, reinventing yourself again." And my thought was exactly that, like, yeah, every day.
Mhm. Mhm.
I just feel like, but it seems to me that's process. There's like a fluidity
Mhm.
to that, or
Mhm.
it's a version of intelligence that's high utility, perhaps, because
Mhm.
then it allows us to be right there in the now with whatever's happening. My wife, who's in healthcare, pointed out the other day that the now of COVID literally changes every 24 hours. Some of
Mhm.
these folks who are publishing in COVID, by the time they publish, it's obsolete. So even
Mhm.
the nature of scientific publishing is changing. So anytime I get to talk to thought leaders like you, I'm always trying to think of concrete examples for our audience to say, oh, I get what they're talking about. And
Mhm.
so if we're going to deliver the best possible and most effective information to people that rely on us to be safe in the face of COVID, we have to quickly be able to grab and shed concepts and see underlying themes that are threads that
Mhm.
last longer. So I think there's a reason to be fluid in a rapidly changing world.
Mhm. Yeah. Yeah. COVID's afforded a lot of opportunities. I just keep thinking about how um, we, the public health sector, we've done a great job with the tools and capacity we have of like increasing access to data. And now our next one of our next big steps is to offer that data in such a way that folks can highlight the main reasons that it was highlighted in such a way it was. Uh,
Mhm.
we might still have a long ways to go.
Yeah, yeah. Well, gosh, you've been so generous today. I want to briefly mention to folks that in the show notes, but just if they hear our podcast, either on Apple or Spotify or YouTube or whatever, they can just go to ifm.org. So India Foxtrot Mike.org. And there's a little free summary right at the top. There's a banner that says Resistance, Resilience, and Recovery. Learn more about the pandemic. And they can just click on that. And there's little free, continuously scientifically updated reference sheets where they can learn about the importance of movement and sleep and personal connection and eating the rainbow, and a little handful of supplements, whether it's garlic or vitamin D or zinc or selenium, et cetera. They can just learn about that stuff. And so I want them to know they can go there and learn more. And then also wanted you to have the reassurance there's a really brilliant transcriptionist that takes what we did, and a month or two from now it'll be a blog, and things you mentioned like your fellowship, et cetera, those will be things people can click on the hyperlink and drill down on. So there's a lot of ramifications out from what you gave us today to benefit people. So I'm really grateful for that.
That's so great. Thanks so much, Rob, for the invite.
You betcha. Have a great day, Lorne, and see you around.
You too. See you around.
Seaworthy exists for people to overcome their health challenges and be fully vital. Please consider subscribing, giving us a 5-star review if we've earned it, and going to our website podcast tab for any questions or comments you'd like to share with us. Thanks.